arises from the posterior ramus of the second cervical nerve. This is the superficial temporal artery. It has an anterior branch and a posterior branch. The artery is related to the superficial temporal vein and the auriculotemporal nerve. The superficial temporal artery is one of the terminal divisions of the external carotid artery. It appears at the upper end of the parotid gland and crosses the root of the zygomatic arch just in front of the tragus of the ear, where its pulsations can be felt. The auriculotemporal nerve is a branch of the mandibular nerve. The superficial temporal vein joins the maxillary vein to form the retromandibular vein, which descends inside the substance of the parotid gland. The vein is closely related to the external carotid artery, which lies deeper to the vein, and to the facial nerve, which crosses superficial to it. This is the orbicularis oculi muscle, with its orbital part that curves around the orbital margin, and its palpebral part lying in the upper and lower lids. This is the platysma muscle. It is one of the facial muscles because it is supplied by the cervical branch of the facial nerve. It lies in the superficial fascia of the neck and is inserted into the lower border of the body of the mandible. Its fibers reach up to the angle of the mouth. It's now reflected to show the structures deep to it. This is the parotid gland. It reaches upwards to the zygomatic arch and the external auditory meatus, and extend downwards between the angle of the mandible and the mastoid process. Observe the relations of its anterior border from above downwards. This is the temporal branch of the facial nerve. It's the uppermost. This is the zygomatic branch of the facial nerve. This is the transverse facial artery, which is a branch of the superficial temporal artery. It runs just below the zygomatic arch. This is the parotid duct, running forward to pierce the vaccinator muscle on its way to open into the vestibule of the mouth cavity opposite the upper second molar tooth. The vaccinator muscle is covered by the buccopharyngeal fascia and the buccal pad of fat. This is the buccal branch of the facial nerve. It supplies the vaccinator muscle. This is the mandibular branch of the facial nerve. It runs over the body of the mandible. Notice the masseter muscle deep to the parotid gland. This is the facial artery and vein. crossing the body of the mandible at the anterior inferior angle of the masseter muscle. The pulsations of the artery can be felt easily at this site. The facial artery is a branch of the external carotid artery and runs anterior to the facial vein. It is tortuous, but the vein is not. The artery reaches very close to the angle of the mouth, where it gives inferior labial and superior labial branches to the lower and upper lips respectively. This is the right side, which is more deeply. The facial artery is seen running superficially to the vaccinator, but runs deep to the other facial muscles attached to the angle of the mouth. It continues up to the angle of the eye, where it's called the angular artery. It anastomoses with the supraorbital and supratracheal arteries. This anastomosis represents a communication between the external and internal carotid arteries. This is the temporalis muscle. It fills the temporal fossa, from which it takes its origin. Its fibers converge deep to the zygomatic arch to be inserted into the coronoid process of the mandible. It's covered by strong, deep fascia, which is called the temporal fascia, that extends from the temporal line above to the upper border of the zygomatic arch below. This is the masseter muscle. Notice the direction of its fibers, which extend downwards and backwards from its origin from the lower border of the zygomatic arch to its insertion into the lateral surface of the ramus of the mandible. All muscles of mastication are supplied by the mandibular nerve. These muscles are temporalis, masseter, and the lateral and medial pterygoid muscles. However, all facial muscles are supplied by the facial nerve and are called muscles of facial expression. The main facial muscles are the orbicularis oculi, the orbicularis oris, and the vaccinator muscle. Now this is the vaccinator muscle. It's the muscle of the cheek. It's pierced by the duct of the parotid gland, and its fibers run medially towards the angle of the mouth to enter the upper and lower lips. These fibers form the extrinsic part of the orbicularis oris muscle, which surrounds the opening of the mouth. The vaccinator muscle is covered by the buccopharyngeal fascia. This is the facial artery, having a tortuous course. This is its inferior labial branch and superior labial branch. This is the facial vein, which has a more straight course behind the artery. This is the deep facial vein, which is a tributary of the facial vein and enters the infratemporal fossa to join the pterygoid plexus of veins. An initial vein passes through the foramen ovale and connects the pterygoid plexus of veins with the cavernous sinus. Remember that the facial vein drains the dangerous area of the face, which is the area around the nose. It's connected with the cavernous sinus through the ophthalmic vein, as well as through the deep facial vein and pterygoid plexus of veins. This is the infraorbital nerve emerging from the infraorbital foramen. It divides into labial, nasal, and palpebral branches. The nerve is the termination of the maxillary nerve and is accompanied by the infraorbital artery, which is a branch of the maxillary artery. This is the parotid fascia, which is an upward continuation of the deep cervical fascia. With the parotid gland reflected laterally, the branches of the facial nerve are seen as they pass forwards. These branches form a plexus inside the parotid gland. The retromandibular vein, also called the posterior facial vein, is seen on the deep aspect of the gland. It is superficial to the external carotid artery. The branches of the facial nerve cross superficial to the vein. The infratemporal fossa is exposed by removing